Hello everyone. Today's video is about natural supports to help folks dealing with traumatic brain injuries or post-concussion syndrome. Nothing I'm saying today should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So I've had a few patients recently reach out saying, I had a concussion. Is there anything you can do to help? And I said, by golly, yes. I've had lots of patients with traumatic brain injuries, persisting symptoms from a concussion, so persistent post-concussion syndrome, as it's sometimes called. And there are a lot of really useful adjuncts that we can bring into the mix in my experience. So I figured I'd do a quick video and just kind of talk about that, because it sounds like it's maybe something that's not widely known about out there. And heaven forbid anyone listening has suffered a traumatic brain injury or concussion or suffers one in the future. Just good to know about those options. These things just happen sometimes, right? Like, slip and fall on the ice, whack your noggin, out skating, hit your noggin, playing sports, things can happen lightning fast, hit your noggin. Or, one of my kids years ago, was in gym class and sustained a concussion. It's like, oh, I'm really glad that I know what to do to support him. And, thankfully he, it was just a very transient issue. There were no persistent symptoms, but I've had patients who have had a concussion and, years before, and they're still suffering with the aftermath, especially if someone's unfortunate enough to have a concussion and then get another one before they've recovered from that previous concussion. Then it can just really exacerbate the underlying things. There can be this kind of exponential negative impact on the nervous system. So in terms of adjuncts that can be helpful, of course, there's all the, standard recommendations, not overdoing it, trying to, minimize excessive strain on the brain, minimizing screen time, honoring how a person's feeling, being exposed to, bright lights and things like that, maybe, having dimmer lighting, again, being mindful of screens, being mindful of reading time, that type of thing. But the way that I explain it to my patients is, if a person, injures their arm, like say you sprained your wrist, well, you're just going to stop using your wrist. I mean, yes, we probably want to do some pain-free range of motion. The old school way of, keep it immobilized, as much as possible. It's that's probably not the best thing for healing. So it's okay, I can move it, this much without any pain. It's okay, probably doing reps of that, several reps of that several times through the day is a good idea. But then, not overdoing it where it's if I go all the way here, oh, that hurts, that's too much. So, pain-free range of motion, probably a good idea, but generally speaking, we're not going to overuse it. The challenge with the brain, when there's a brain injury, that's where you can't not use your brain. We can minimize the use of our brain to some extent, but our brains are always working, so it becomes that much harder to, it could be why it takes so much time in some cases for the brain to heal. So anyways, aside from some of those, shall we say, occupational therapy interventions, there are a lot of things we can do on more of a supplemental level. So for example, using different antioxidants. So glutathione can be helpful, mixed tocopherol, mixed tocotrienol, supplements like a vitamin E complex. Most vitamin E supplements, if you look at the label, it's just alpha tocopherol. Vitamin E is actually a family of 8 different molecules. So it'd be like saying, oh, I'm going to take, B vitamins, and you look on the label and it's just vitamin B3. It's what about all the other Bs? Well, what about all the other Es? So anyways, glutathione mixed, a complete vitamin E complex. Molecular hydrogen can be very helpful in some cases. Methylene blue can be helpful in some cases. We have to be mindful with methylene blue because there's a few medication interactions we have to watch out for. I posted quite a few videos about methylene blue, so you can cross-reference those if you're so inclined. There's other resources out there on methylene blue outside of my videos as well. So antioxidants can be helpful. Mitochondrial support can also be very helpful, because as our brains are striving to heal, we want to make sure that they have all of the energy and resources that they need in order to heal. And so in order to heal, we need energy. And when the brain is struggling because it's been injured, then the cellular ability to make energy could be compromised to some extent. So if a patient comes in saying, I'm having these post-concussion syndrome / traumatic brain injury related symptoms, and they also say I'm got a lot of brain fog, I'm feeling quite tired, that's a big clue for me to say you probably need some comprehensive mitochondrial support. I've also posted lots of videos about comprehensive mitochondrial support, so I won't get into that in detail here, but short answer or a short explanation is that it's a comprehensive blend of amino acids, vitamins, minerals, antioxidants that are needed for the brain to function optimally. And in that comprehensive mitochondrial support, it does not include the glutathione. It does include vitamin E, like the mixed tocopherols, mixed tocotrienols. Sometimes we need a higher dose than what's in the mitochondrial support, and it doesn't have molecular hydrogen, and it certainly doesn't have methylene blue in there. So unfortunately, or just it is what it is, when folks are really struggling with post-concussion syndrome or the sequelae of a traumatic brain injury, they oftentimes need to take several things. It's not just like a one supplement and they're good to go. Like oftentimes they need to be on like 1 or 2 or 3 antioxidants, a comprehensive mitochondrial support formula. It's also it's also helpful in a lot of those cases to work with things that have a kind of structural support for the cell membranes of the neurons. So a phospholipid complex. So I've also posted other videos. I've posted lots of videos, man, oh man, about it's oftentimes helpful to take a pharmaceutical grade phospholipid complex. I had an interview on my Overcoming Chronic Illness podcast maybe a year or so ago, year and a half ago, with Justine Stenger. She's a nutritionist from Alberta, and she talked about the importance of, pharmaceutical grade phospholipid formula versus just a standard phospholipid formula. And ever since that interview, I have certainly found that what she said is absolutely true, that there's a huge difference in efficacy with those really high grade phospholipid formulas. I have no financial interest in any of those formulas, but just mentioning, like, there's a company called Body Bio, that's I believe who Justine uses, because what she said, and I believe she still does. That's the most cost-effective option I found for a pharmaceutical grade phospholipid formula. Designs for Health makes one as well. So does the company Seeking Health. So they make these higher end phospholipid formulas, but those can be really helpful. And over and above that, sometimes working with things that have more of a neuroregenerative property to them. So things like lion's mane mushroom, methylene blue kind of bridges that gap to some extent. Resveratrol and quercetin have some neuroregenerative properties to some extent. And then there are different IV therapies that we can work with, like IV ozone therapy is one of the best things to work with to help with one of the best IV therapies as an adjunct for post-concussion syndrome or traumatic brain injuries. Other IV formulas can be helpful, like say Myers cocktails, like IV nutrient infusions can be helpful, although I've just found historically that with using comprehensive mitochondrial support formula for so many years now, I used to do Myers cocktails. I refer patients for them all the time, and I've just found that the mitochondrial support usually packs more punch than that, and it's just so much more cost effective. So I do that, but we still use them if people have major absorption issues. We still use the Myers cocktails / nutrient infusions, but oftentimes we don't really need to go there as much. If we really need to hit things hard, then IV methylene blue is an option, IV glutathione, those types of things, IV phospholipids. So we can certainly use IV adjuncts. Hyperbaric oxygen therapy is something to consider. HBOT is unfortunately not the easiest to access. It's time consuming, it's expensive, and it's not fast, but it is, there is some good research literature indicating that it can be helpful. So that is something to have on one's radar when thinking about this too. Neurofeedback can also be helpful as an adjunct for healing post TBI, post concussion, but we have to be mindful, because when we use neurofeedback, it is asking the brain to do more work. So as much as neurofeedback, to my understanding, it does trigger these neuroplasticity pathways, triggers more blood flow, triggers the release of compounds like brain-derived neurotrophic factor / BDNF in the brain. It is asking the brain to do more work. So I've had some patients, like we've done thousands of neurofeedback treatments at our clinic. Most patients tolerate it incredibly well. Even folks who are dealing with complex chronic illness, like really debilitated with chronic fatigue syndrome, Lyme disease, mold toxicity, etc., they oftentimes tolerate it incredibly well. But the patient population that we have to just usually start like low and slow with is the folks with history of brain injury, because it is asking the brain to essentially exercise. So just like that person with the sprained wrist, if we say, okay, like, I want you to do pain-free range of motion, like no problem. Okay, now I want you to do, pain-free range of motion holding a 5-pound weight. I might be like, oh, that's too much. So it might be like, okay, let's try it with a 1-pound weight. That's fine. 2-pound weight. That's fine. 3-pound weight. It's maybe stretching a little. Okay, go back down to 2 pounds. So with neurofeedback, normally the sessions are half an hour in length. With a patient with a history of a brain injury, we might start with them with 5 minutes, and if that goes fine, 10 minutes, and then 15 minutes, and gradually build up. 20 minutes, like, I felt kind of tired. I felt sort of like I had to take the rest of the day off. Like, okay, let's go back down to 15 minutes. We're going to drop it back down. So that can be a useful adjunct. The one other topic that I'll just quickly mention here, one other adjunct, is that there can be some really helpful physical therapies as well. So, working with someone who's like a neuro chiropractor or a neuro optometrist, like folks that have specialties in helping folks to recover from brain injuries, in more of like the physical rehab realm and the I guess the eye rehab realm. There's obviously our eyes are intimately connected to our nervous systems because they allow us to see and process all the input that we get through our eyes. But it turns out that there is also a really significant sort of physical connection there as well. And so there are different eye exercises, prism glasses, different things like that can be really helpful. So while neurooptometry, it's not fast in my experience, it also can sometimes create some side effects, like it can exacerbate dizziness and headaches and things like that if the right glasses or the right treatments are started too quickly, or maybe the approach needs to be modified. Sometimes it can be a little bit tumultuous. Sometimes it's very smooth and easy, but just some patients have had some pretty notable flare-ups, so it's not always an easy road. But I've had patients where when they find the right eye exercises and or the right prism glasses, it's just like night and day difference. So it can be very, very helpful to speed up recovery, to work with someone who specializes in that area. There are other adjuncts that can be helpful too. Sometimes when there's, say, a neck injury element to the, so the concussion also came along with a significant neck injury, doing regenerative injections like prolotherapy or PRP or ozone injections or some combination of the above can be really, really helpful, because sometimes the underlying neck issue is exacerbating a lot of the other symptoms that folks are experiencing. So that can be really helpful. And there's certainly other good adjuncts like acupuncture and osteopathy and various other things too. So there are lots of tools that are available. I have patients where they are literally working with a network of like half a dozen different providers to help recover from their TBI. Now that can be cumbersome and very expensive, and also challenging to put together a whole team approach to work on that. So I'm certainly not insinuating that patients need to have all of those tools or resources in place to get better, but there are, anyways, lots of different options out there, and some folks, they seem to do better when they have all those resources on board. So anyways, I'll leave it there for now. If you don't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. If you have any follow-up questions on this topic, or anything you want to add, experiences that you yourself or a family member or someone you know have had where they feel like, oh, this therapy was helpful that either I mentioned or didn't mention, or anything you want to share in the comment section, please consider posting. And yeah, any questions about anything else, just post in the comment section and I'll do my best to answer as soon as I can.